sudden fluctuations or interferences. So similarly, parathyroid hormone may have, but there is no such circadian rhythm or other things of parathyroid hormone as such I have heard of. So, but yes, there are factors which can alter parathyroid hormones particularly. Uh, if you have come across certain things, you can share with me.
Sure, sir. I mean, we have came across in variations in case of pediatric cases, wherein the PTH values were not correlating with the vitamin D or parathyroid, sorry, phosphorus levels. So we received some queries from the pediatrician that these values are not correlating, and we recollected. So sometimes there was some pre-analytical issue, not
Major
analytical
problem with
but
the vitamin
pre-analytical.
D. Yeah, major, absolutely. Major problem with vitamin D is you don't know which one is actually the correct result or correct value, because the vitamin D reference range is given as per the Western study. Till
Right.
date, there is no such vitamin D reference range is created for Indian scenario. And you know, any study, no study, because vitamin D is a lucrative parameter for lab medicine people, lucrative parameter for companies who produce the reagent, and a lucrative parameter for the pharma companies also, because vitamin D is actually prescribed at random. So
Right.
the amount a person having hale and hearty tests, hale and hearty results, you are fine, having no problem. Your calcium is around 10. Everything is normal. Your vitamin D is 12 when the clinician is giving you vitamin D to treatment. Do you think that is at all necessary? No. Just because we don't have a reference range, how can it be correlated? Because we don't have a India specific reference range. I'm very sure that if you do an India specific reference range, it will be around 1 to 10 or something.
Right.
Because
Sure.
every day, every alternate day, I'm releasing people's report 15, 14 with absolutely normal condition of calcium metabolism. So if the person would have been a hypothyroid, then there would have been some effect in other parameters as well. And that is why it will never match clinically for you.
True, sir. Thank you so much, sir. So one more question from my side. Sir, regarding prolactin that you mentioned about hook effect.
Mhm.
So how to avoid releasing such reports? It's only after the clinician complains or the patient complains we are able to know that there was a hook effect and we have released a false no reports.
You couldn't get it. What is that?
Uh, Hello, sir. Regarding prolactin that you mentioned, there was a hook effect, and we have
Hmm.
released a normal report wherein the patient was a case of hyperprolactinemia. So
See,
this is only a
I got
post
your
receiving a
question.
query.
Because now you tell from a scenario when you are in the lab, you are releasing per day around 40, 50 prolactins. So out of
Right.
40, 50, the 40 prolactins, 36 coming normal. Because it usually comes normal.
Right.
For any gynecologist, anybody who is coming for an antenatal checkup or even coming for a IVF treatment or something, they always write prolactin. So you release prolactin every day. So out of 36 prolactin, can you afford to give 1 in 100 dilution to each one of them?
No,
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 no.
no.
So you have to choose those cases for a dilution when your clinician gives an alarming sign. Because unfortunately in India, we don't have a fullest medical history. Not in any
Hmm.
standalone, not even in a hospital. Even if
Hmm.
your hospital having an EMR facility, that extended medical report record facility, neither your clinicians nor even your junior doctors do have any idea to fill up the records properly. So you cannot look at the records and find the things. That is why I am saying that only clinicians' direct interaction can save you in those cases. Otherwise, how many dilutions you will do per day?
True, sir. That's true. Clinical history, getting clinical history is a challenge in India.
Absolutely.
Yes, sir. Thank you so much, sir.
So we still have 10 minutes. We have requested sir to remain online for 10 more minutes. So Any more questions?
Thank you for your explanation. Sir, 9 once again. The normal CKMB was like up to 25
Yeah.
units per liter. So if CKMB increases more than 25, so does it not relate to the heart?
Yeah, very good question. Very good question, because that is that particular perception I am going to change. Have you ever checked any shock trauma unit reports? You will find that a person with a road traffic accident having CPKMB 1500 possible, because the both legs are crushed. The CPK value is 70,000. Even a 70,000 CPK value, 1500 comes to be around only 2%. So you are just forgetting CPKMB is present in your cardiac muscle, but CPKMB is also present in your skeletal muscle as well. It is present in 2 to 4%. So if your skeletal muscle getting crushed, 60 to 70,000 CPKs come up. So even a 2% can be 1400 to 1500. Got my point?
Yes, sir.
Similarly, yeah, that is where I'm saying only CPKMB cannot define anything. Please never ever ask any patient to go for sole CKMB report. It is meaningless.
And
Until
in that,
it is quantitated with CK, and it is coming between 4 to 25%. Why I'm stressing on this 4 to 25%? Because in cardiac muscle, it is not only CKMB, CPK also
yes,
present in cardiac muscle.
yes,
And the percentage of CPKMB in
yes,
cardiac muscle is 4 to 25% of total CPK.
yes,
That is why if my result suggests that my CPKMB is high and also it is around 20% of total CPK, I will definitely think this CPKMB is cardiac origin.
yes.
There
And
are certain
in that
conditions like
same
the
case,
irritable
the
bowel syndrome or colorectal carcinoma. The patient genetically develops macro CK. I don't know why. Don't ask me explanations, but they do. In
okay,
those cases, you will always find a CPK 150 and CKMB 130.
okay,
Despite of the fact that CKMB is beyond normal, but this can never be a cardiac origin. Abnormal for sure. Report is abnormal.
yes,
But
sir.
it is not of cardiac origin, because anything goes beyond 25%, probably it's a macro CK. Why? I'm just explaining in detail. Have you checked your testing? In CPK, the factor by which you multiply the factor is around 1739. In CKMB, it is about 4554. Okay. Now, even because of the large size, inhibition is hampered 50%. Your result is tossed 4 times because the factor is 4 times high.
Okay.
That is why sometimes he will, one of the very learned person in Mumbai, in his presentation was presenting that this macro CK, that he has got a CK 100 and CKMB 114, and he has reported. Fine. I asked only one question to that person, that please explain the population of Maharashtra is higher than population of India.
Yes,
Yeah, because CKMB is a part of CPK. Cannot
yes,
be more than. It is a falsely high showing by your miscalculation. So
yes,
this my advice is, this kind of thing will also come to you when CKMB is showing higher than CPK. For God's sake, never ever report that. You can report same, but don't report CKMB higher than CPK, because a part cannot be higher than total.
yes.
If you
And
want
in
to,
that same
in
question,
that case, you have to manipulate your result, modify your result, but manipulation for good. Because you won't be able to stand if somebody asks questions like me to that person. If somebody like me comes in front of you, unfortunately, he will heckle you like anything.
Hmm. And in that same question, the NT-proBNP, that was also high?
And because the patient was having congestive cardiac failure,
Okay.
not MI.
Okay.
The hint was given there only.
Hmm.
Antiprogen, because shortness of breath was because of CCF, not because of MI.
Okay.
Got my point?
Yes. Thank you, sir.
I have not found as of now, but it is possible. Very much possible. So any exercise or any stress or stimulation actually jeopardizes your hormonal milieu and all other milieu of your body transiently. So it is possible that because of that transient effect, an LPA has got very high. Because as you know, there are certain lipoproteins also and acute phase reactants. I don't know LPA comes under this or not. Yeah, they do come. They do come. Certain instruments they have, but honestly speaking, you should not depend on your patient instruments looking effect fraction. So they come. But sometimes I have seen that the values has to be very high before the instrument sensitizes it to be a hooking effect. So I don't believe on instrument in those cases. I always believe on the clinician's feedback for this. I'm fortunate I work in a hospital-based laboratory, so I can access any of my physicians anytime. But yeah, it is in a standalone laboratory. This is a very difficult thing. So I don't know how they match up the things.